Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, when I called Dr. Ayar, I asked him how he was doing. He says, well, we're curing cancer today. I love that. He is a dermatologist, and he runs his company called Dermatology Experts. And we're so happy to talk to him. You know, Dr. Ayar, when I look at your advertising, you seem like you can do almost everything here. And
yeah.
So when you schedule people, do you try to get everybody of the same kind of disease for that day? How do you do that?
No, I operate here in a patient-first manner. So I try to leave as many options open and be as versatile as I can for the convenience of my patients. So I like to offer anything. I do everything, so I like to offer all my services anytime you need them. So whatever you need, whether it be just a skin check or if you need a cosmetic consult, if you need a consult for CoolSculpt, if you have a scar that needs to be revised, earlobe repair, anything that you need, I can get it done as long as I'm in the office anytime that's available. So as long as I'm here, you can come anytime. I don't like to do just skin cancers. Some people do surgeries all on one day and cosmetics on another day. But, I find, for the one or two patients, they like to do it on a different day or that day doesn't work for them. So I have to be as versatile and accommodating as I can because it is customer service here, even though it's medicine.
You're so good. And I know when I met you have this wonderful personality. A lot of doctors, unfortunately, they don't really have that same push that you do. You're so friendly, and I think it makes a difference. I've always said that sometimes it's not the medication or the surgery, but it's the doctor. When you have confidence in them, that's part of the medication.
Mm-hmm. Yep, that is. It definitely is. It's mental as well as physical, so you have to take care of both.
So do you do the Mohs, M-O-H-S, surgery yourself, or do you have someone that does that?
I do that myself. So I trained with a few doctors who did it, and I did some in my training as well. I've done thousands of cases, and so I do it myself in my office. And again, if I'm here, I can take care of it for you.
So tell us what that really consists of, please, and what you do that for and how that's different from other things.
Yep. So skin cancers are very, very common in Florida. So Mohs is a way so when you come into the office and you have a spot, you say, I don't know what this spot is. I can evaluate it and tell you pretty much what it is by looking at it. But to confirm it, we take a biopsy. So once you biopsy it, I don't read my biopsies in my office here. Some dermatologists do. Most of them don't. They send it off to a dermatopathologist. Dermatopathologists, all they do all day is sit at a desk and in front of a microscope and read slides of histology of either skin or whatever other tissue they have in front of them. So that's what they do all day is read pathology. And they tell me what it is. And if they confirm that it is a basal cell or a squamous cell skin cancer, the two most common forms of cancer in the world, I have to treat that for the patient. And depending on the specific type that it is, there's different treatments for it. So, the most common and really the most efficacious, meaning the highest cure and clearance rates, is to get rid of all the cells physically by cutting them out. So if the lesion is small and it's on the back, you usually can just mark it out and cut it out, take a little bit wider than what you see on the patient's back, so cut around there and stitch it up and you send that out, and typically that gets all of it. The back has a lot of skin, though, so you can be generous with how much you take off. And normally you get good cure rates there. About 95% you get it on the first try. But places on, like, the face or on the ear or on the hand, and tough places like that, if you have a basal or a squamous cell, there's not a whole lot to give there. So you have to be very judicious with the amount of skin that's removed. And for those people, we do the Mohs surgery. What is Mohs surgery? Mohs surgery is just normal surgery, but it's done in a different way, and it's cut out in a different way and processed a different way so that the doctor who's doing the surgery reads the histology, the margins of the tumor under the microscope in his office. So we have a lab in the office. We have a histotech here. She preps frozen sections of the tissue in her lab, and she creates slides for me. And after I do the surgery, I leave the room, and she preps the slides. It takes about 30 minutes to generate slides. I look at those slides, and I read them. And I see whether I got all of the cancer or if there's some left. We mark the tissue, so if there's a positive area, we don't have to go back and take out the whole circle around where the tumor was. We can find out where the tumor was exactly, let's say at like the 3 o'clock margin. Then we just go take a little piece around the 3 o'clock margin and just clear where the tumor is extending, not the whole good skin around. So you ensure tumor clearance with Mohs, and it's skin sparing. So you don't take out you don't take out more skin than you need. So you just take out just where the tumor is. And that typically leaves smaller defects or holes where the tumor was, and those need to be repaired surgically. And what we do is we use different plastic surgery techniques to close them up so that they heal up just as nicely as before you had the tumor there at all.
Oh, okay. That was my question. So it stitches up. I mean, it heals so that you can't tell?
A lot of the times, yes. You will have a tiny little scar in the area, but we can close it and, manipulate it in a way where when it's all healed, I would say half of my patients, I can't even tell where I did the procedure. Even if it's a large area, and they leave the office with all these stitches, and they say, oh, Lord, I'm never going to look quite the same. And then they come back in a month or two, and I really have to, look at the picture to see where the scar even was.
No kidding.
So we had really good outcomes with our closures and our scars, thank God. It doesn't happen for everybody. Some people scar a little bit differently than other people, and there's thicker scars. Well, luckily for that, we have treatments for that. We have an array of lasers and injections and abrasions and things we can do to mask the scar, and we provide that service complimentary. If that just happens to you and we can help you, we'll just take care of it for you as part of our service here, not as like an extra cosmetic cost.
You are just great. I love talking to you. So I'll ask you a question. I see that you take care of shingles. If I want a shot for shingles, can I get it with you? Do you have them?
Vaccines, I leave the vaccinations for primary care.
Oh, okay.
A lot of patients have been asking me lately. I've been seeing a lot of shingles, and shingles can come out when we're sick or if we get a lot of sun or a sunburn. Our chicken pox that we had when we were a kid can come back in a little tender area as little vesicles, and that's what shingles is. So in Florida, we get a lot of sun here, so I get a lot of people who get shingles on their head and neck, and that's probably from just too much sun exposure, getting a sunburn. And when you get shingles, you are at a lower risk of developing it again, but the government agency which controls vaccines, they still recommend getting a shingles vaccine in the event that you did have an active shingles outbreak. But typically I let the primary care deal with that so they can just keep track of everything. Okay,
well, that's good. All right, I want to just keep going down this wonderful list that you have. So now you have, I see it advertised all the time, psoriasis. I see it advertised that there's certain kinds of medications. What do you do for psoriasis?
Oh, boy.
The
list every year gets longer and longer for treatments for psoriasis. So it's wonderful. Well, just 10 years ago, there was maybe a couple of options for treatment. There's creams that you can do, and creams are still the first line. And if you have a small area where you can treat it with creams, I stick with creams because it's the lowest risk and it's the easiest and it's the cheapest. But if you have it all over, then there's new oral medications and there's new systemic medications which come in the syringes that are coming out seemingly, every year there's a new player, and they're just targeting different kinds of psoriasis. So people with psoriasis, what's really nice is that there's so many treatment options now. There's so much great research being done and so much discovery that psoriasis is very treatable in the office, and the list is long. And like I said, there's creams. You can do light therapy, which is done in an office, and then there's oral medications, and then there's injectable medications. And they're all targeted a little bit differently to treat the psoriasis that you have. And sometimes you just sort of treat with different ones just because one doesn't work. There's always another option.
I want to go back to Mohs one more minute because I forgot to ask you a question. What if you don't know you have it? You don't go to a dermatologist and it just grow. Does it grow very fast to have something that...
Everybody is different. So skin cancer is funny. Like, we call things skin cancer, but skin cancer comes in all different shapes and sizes. I've had melanomas where patients came in 6 months before and they had normal skin, like literally not a mark on their skin. And they reported to me a couple months after they were in their office, they noticed a little black dot. And over the course of 3 or 4 months, the black dot turned into a volcano that started bleeding. And by the time they got back to me in 6 months, I biopsied it. They had a deep melanoma that required chemo, radiation, and big surgery. So that's melanoma. Do all melanomas do that? Certainly not. That was probably one of the most aggressive cases I've ever seen. Some melanomas can sit on your face for 10 years and not spread. So they're all different. So you never quite know what you're going to get. So in general, yes, melanomas can last a year or 2 or 3, and then they sort of percolate through your skin, and they try to find a blood vessel, and then they try to spread throughout the rest of your body. That's what cancer does. It just sort of takes over. Basal cell, luckily, is the most common cancer in the world, but it's not the kind that typically spreads. Maybe 1 in 10 million or 5 million.
So it can just stay there?
It stays there, but what does it do? They call it the rat ulcer. Why is that? Well, it eats your skin. It eats a hole in your skin, and it'll expose your flesh underneath. And once that happens, one, you have a hole, like literally a hole or an ulcer in your skin, and that can become infected. And that infection can ooze and be, really terrible and very painful. So if you just leave it, you'll get an ulcer that will grow, and it'll eat a hole in your skin wherever it is, on the nose, eyelid, lip, and it'll just keep growing. It can get infected. And I've seen many people, lose like their entire nose or a giant chunk of their eyelid or their scalp from skin cancers that they let fester. So it won't spread throughout your body, but it'll take a wide area to clear it out, and it can just grow and cause problems in other ways, not by spreading, by spreading through the rest of the body, but spreading locally.
That's really interesting. So you don't know. So you should really get it taken care of. And the smaller it is, the easier it is, I have to assume.
Oh, Lord, yeah. If you keep up with a dermatologist and they do a total body skin check head to toe every 6 months, they're going to catch whatever you have pretty early, And once you catch something early, the treatment for it is just, night and day difference. It's the difference between being in and out of the office in 45 minutes or 6-7 hours, or having to go to an operating room because it's kind of gotten out of control.
Well, let me tell you, everybody, this interesting, very, very smart Dr. Angelo Ayar is, of course, a dermatologist, and he helps with dermatology and cosmetic treatments. He is located in Tamarac. Let me give you his phone number. It's 954-726-2000. I'm going to repeat that, but remember, this is Pencil Talk Radio. You want to write this down. This is a dermatologist you'll want to go and see. I know you don't want to go to a dermatologist, but if you're going to go to one, go see Dr. Ayar. It's 954-726-2000. And his website is derm-experts.com. derm-expert.com. Okay, I know something that you love and is on your list is Coolsculpting. Tell us what that is.
What is Coolsculpting? Well, it takes the idea, about 10, 15 years ago, some scientists from Harvard found in young children who were putting popsicles in their mouth that the fat pads in their cheeks were thinner from holding popsicles in their mouth for a long period of time. They took that technology, verified it, and they found out that if you freeze an area at a certain level in a certain way for a certain amount of time, the fat cells will get destroyed and released, exit from your body. So they'll be destroyed, resorbed, and then exited from your body. And so they took that technology into, they call body contouring and fat destruction. And it's non-invasive. Basically what it is is if you have an area of fat on your body that you don't like, that sticks out, that for me it's, kind of on my back, if it does help, just sort of whatever you do, you can't get rid of it, or you just sort of can't seem to do anything about it, and you don't like the way it looks, or it doesn't make your clothes fit quite right. Our Coolsculpting machine is a vacuum and a cold suctioning machine. We put it on the area in a certain way for 30 minutes, and then you massage the area for 2 minutes. Then over the next 3 months, that area will shrink. So you can shrink areas of fat on your body with the Coolsculpting machine. And I remember doing this when I was in training about 5 years ago, and it was getting pretty popular and sort of skeptical. But in the last 5 years, it has exploded and has become a household name. And the person who invented it, he just sold it to a large cosmetic company this past year for $2.5 billion.
That's with a B?
B.
Oh, my goodness.
B. And so that didn't happen because he had a good gimmick. It happened because it works. And they say just let people try it. They'll see it, and they'll love it. If they have areas on their body where they don't like this area pooching out, or their clothes don't fit quite right, their dress doesn't quite fit, and this is just area I just want to, shrink it a little bit. And there's nothing I really have done has been able to get rid of it, or I just want to see if this machine can help me. They come in for a consultation. This machine is so well made, and there's so many different pieces for every little part of the body, that usually we can help shrink an area of fat that you don't like, non-invasively. So you're in and out of the office within an hour if it's just one area, and you can go back to work. Versus the typical way to get rid of fat is liposuction, which requires anesthesia, being put under operating room, and months of recovery. It's a very physical process where they take a probe and jab it in and try to suck the fat out. That is no more with this machine. It's a non-invasive fat destruction body contouring, and that's the reason, and it works, and that's the reason this company has become so popular. And, they were just really, really encouraging me to offer it in my office. And I said, my patient base, I'm not sure. People are not clamoring for this. They said, just put it in your office. You'll see people start to just migrate towards you, and that's been true. I just offered
Really?
it as a service here, and people are just coming out of the woodworks for it. So it's been great.
Wow. And so have you tried it yourself? Do you ever try these things on yourself first?
I try everything on myself. And yes, I know what it feels like. I know how to use it. I know what the after effects are. And it is, once you start doing it, it is like addicting. You really notice a difference. And it has just been great. And I'm glad I'm the owner of it, so I can get a little discount for it. I paid for the machine, but yeah, it's fantastic. I see myself using this for a long time to come.
So tell me where the favorite areas are that people come in for. Is it under their arms? Will you do the fat from there?
Yes. So that's a big one with my patient population. Under their arms, they said, hey, I look like I have wings. And somebody in the office had this problem as well. And we are actually doing an experiment where we're doing one side but not the other side. And we've seen somebody else do this in their office, and you literally see, after one treatment, with their arms laid out, almost no hanging skin on one side, or very, mild amount of hanging skin on one side, and the other side literally hanging down about 8 inches after one treatment.
Really?
So it is remarkable, and people see that, and they just sign right up. So underarms is great if you have those hanging areas. The love handles are great. The whole stomach is great. It takes more than one paddle if you want to do the whole stomach, but the stomach has been great.
Excuse me, let me ask you a
thighs,
question.
Underneath the chin.
So while this is, what about your neck?
You can do, yes, the neck, under,
Turkey necks.
Yep, so the person in our office who has the hanging arms, we're also doing the turkey neck. It takes 2 months to start seeing the results, 3 months to get the full result. And we just got the machine, a month ago, so we haven't seen the full result yet, but we're starting to see it now. And we're going to, post all the photos, and once we get more and more pictures, we're just going to be displaying them and putting them in books just so people can see. And it really sort of sells itself. It's great.
Wow. Yeah. I mean, I see a lot of advertising for it, but I'll tell you what I do see, which I think is wrong. There are companies doing this who are not dermatologists.
Yes. So,
And that, I don't like that. I think that under your direction and your skill, don't you agree?
yes. So I'm involved personally, in the consult, in the application, and in the whole thing. I can't point anybody out, but it's always safer to be under the care of a doctor who's in the office, who's there for you in case anything happens, in case you have any questions. They're certified, they're educated, they have the skills to handle, any problems that might arise. And also, they just have more knowledge. So when you're more knowledgeable, you can troubleshoot and target areas and have things work a little bit better than they would in anybody else's hands. So just for a whole host of reasons, you want to make sure you're going to a doctor's office and having them there or under your care or directly or indirectly, or having them consult on your specific case to make sure you're getting the best, safest results.
Right. I know. I like that about you. You're very much that way. Well, so Coolsculpting, everybody. That's something to think about. Now, let's just say the magic word, Medicare. Medicare does pay for a lot of the things we talked about, the Mohs and the psoriasis and I guess the shingles, but they probably don't pay for Coolsculpting.
No, it's considered cosmetic.
Right.
So, not medically necessary. So Medicare doesn't pay for that. But we do have, there's, even with Coolsculpting, they, as a company, have partnered with somebody to offer specific financing for it, which is like cheaper than you can get with any credit card. So let's say you couldn't afford it today, they'll work out a payment plan for you, with you. So you don't have to come up with the money on day one. You can work it out. You could pay it out over a number of years, and they offer that as part of the system. It's like a mini franchise in your office. It's great. So you can tell anybody that they can be approved within 90 seconds, and they can get their treatment and pay it off, like they would anything else.
Right. Well, and that's really something that, it's interesting. We say that that's not medical, but in a sense, mentally, if you have some really serious extra fat, I'll bet it could make you feel so much better that your health will improve.
That's definitely true. Like psychologically or even physically, certain areas, can be really just sort of bothersome to you. So, yeah, you're right. Like my, somebody who's here, who I won't name, they're so fixated on their arms and they're just so like literally throughout the day they're just fidgeting with it or thinking about it or something. So they're just fixated on it. And once they got taken care of, it was like a weight was off their shoulders. It was like I gave them a medical treatment. So you're right. In a sense, it is.
Yeah.
I mean, that's hard to. Medicare is not going to.
No, they're not going to.
They're not going to buy it,
that.
but as like a medical treatment, something that can really improve your quality of life, definitely.
Let me tell everybody again. You're listening to Dr. Angelo Ayar, AYAR, and his phone number to make an appointment is 954-726-2000. That's 954-726-2000. Now, there are people who already have dermatologists, but maybe you're having something that doesn't look so good. Dr. Ayar would love to give you a second opinion. Don't forget second opinions. I've heard of stories where someone's going to go into having a lot of surgery, they go have a second opinion, and it had nothing to do with it. In fact, my dog, I had that same problem with my dog, and I went to one vet, and he wanted to do a lot of things. I went to another, it wasn't necessary, and my dog was fine, no operation. So I love second opinions.
Yeah.
So if you don't have a dermatologist and you're looking for someone, please do consider making an appointment to meet with Dr. Ayar. If you do, go ahead.
I'm sorry, I was saying, just sorry to cut you off there, but in terms of in our office, I have seen patients, maybe not even a second opinion, or they just came back to the office or found me, or for whatever reason, they say, oh, that spot's fine, that's been looked at, the doctor said it was fine, and my antennas are still up, saying in my gut, this is probably not fine, and this has to be addressed. So I have to do some convincing, and when I have that sort of feeling, and 9 times out of 10, and I find something and they say, "Oh, the other doctor said it was fine," I can't tell you how many melanomas I've found that way.
Really?
Just this past week, yeah. They said, "Oh, someone looked at that. They even sampled it, and they said it was fine after they sampled it." I said, "You know what? It needs another one." And sure enough, it's happened to me more times than not. So there's also, if you need an appointment right away, luckily, we still have openings because we're a little bit newer. We have openings to see patients within a week. So if you don't want to wait 3 months, you can come see a doctor in a week.
Right.
And in other practices, they only have a nurse practitioner on site, or a PA. And there's recent data has shown that PAs are not as good, or they don't find as many melanomas as a doctor would. So the newer research is showing they're not as good and proficient at finding cancer, and they do more biopsies in addition to that and find less.
Well, Dr. Ayar, it's always a pleasure talking with you. I look forward. I need to see you again. I'm so glad that I had a chance to talk with you, and I'll have to get down to your office and see how it all looks. So thank you very much for taking your time. I'm sure people are going to listen, and they're going to come and see you.
I really appreciate it. It's always a pleasure talking with you.
For me too, Dr. Ayar.
And your audience as well. Thank you so much.
Okay, bye.
All right, bye-bye.